What's up, guys? Fooch from Fooch TV here today, and I have some quite scary news to report. 101 suspected flu shot deaths reported in South Korea. Now, throughout the weeks, more deaths have been happening. A couple of weeks ago, the most scary piece of news came out where a 17-year-old boy who got a flu vaccination had died as a result. Let's take a look at this article today. It says that the South Korea's health agency said Tuesday that a total of 101 people, most of whom were elderly, died after receiving the seasonal flu vaccines. I'm not sure about the number of deaths that normally occur from getting the vaccine, but clearly this is news as it's actually being reported about. The deaths had stoked public anxiety over the safety of such vaccines, but apparently the Korean Disease Control and Prevention Agency said 97 of those deaths have very limited relation to the flu shots, which is kind of weird. I don't know why they would include that in the number of people if the reason for death really didn't have anything to do with the flu shot. But I guess we kind of see this with the coronavirus, where many people who die of the coronavirus may have had other complication, many other complications, like people who got shot and were in the hospital, and they were in critical condition. If they happen to get the coronavirus in that state, that death counts as a coronavirus death, not a death due to the gunshot wound. So it could be a case of that where people who were about to die got the vaccine and then they died, so it didn't have that much of a role to do with their death, but it still got counted as a flu vaccine death. But 101, like I said, they're reporting about this. These reports have been coming out. Before it was, I think it was 20, then 50, now it's over 100. A breakdown of the total 84 people were aged 70, followed by aged over 70. 84 people were aged over 70, followed by 8 under 60, and 9 in their 60s. 60s is quite young, but 9 people have passed away. And of course, the most scary death was the 17-year-old who got the shot and who had died as a result. However, health authorities have repeatedly said they have found no direct link between flu shots and deaths, urging people to get flu vaccinations before the onset of winter amid the coronavirus pandemic. Public anxiety is heightened over the safety after some of the vaccine bottles, part of the country's free inoculation program, were exposed to room temperature during distribution. The authorities, however, said there were no safety issues. Now, I am not an anti-vaxxer. I think everyone should get their kids vaccinated with things for, smallpox, the measles, polio, anything that we have a vaccine for. I think children should be getting those vaccine shots, so I'm not an anti-vaxxer. Of course, there are very rare occasions of some sort of reaction happening with other ingredients in the vaccine that cause some sort of either death or permanent damage or other major health problems as a result, and those are, of course, unfortunate. However, I do think the vaccines are safe and everyone should get vaccinated. But after reading this, I am definitely not getting a flu shot vaccination. I was thinking about it because, if I get the flu, it's not a big deal, except I have to call out of work. And, in my line of work, I can't be making videos. I can't be doing some of the other work that I'm doing. So I don't want time away from work. So I was kind of thinking about doing it, even though I've never gotten a flu shot before, at least not in recent memory. But after this news, I am definitely not doing it. It should be noted that so far more than 12.56 million South Koreans have received free state flu shots out of about the 19 million people, or 64.1%. So that's 61% of people who have gotten the free shots out of the 19 million people. 100 deaths out of 12.5 million, of course, is not a lot at all. However, any deaths occurring because of the flu virus, kind of scare me, and I'm definitely not getting it. I've had a couple of friends that gotten it. They said they felt, maybe normal symptoms of kind of, they feel like they're getting the flu, but then it's very mild and then they overcome it. So I guess they're protected. Luckily, nothing happened to them. I'm definitely not getting the flu shot as a result of this. But I think more on this is the coronavirus vaccine, which is apparently it's nearly done. It's going to be shipping. Pfizer said their vaccine has they have a 90% success rate. But everyone says, oh, the vaccine is going to end the virus. The vaccine is going to end the virus. Everyone I've spoken to they've all said that nobody wants to get the vaccine. Especially, I'm definitely not getting the vaccine. This vaccine is rushed. We don't know the implications of that. Bill Gates came out on CBS some time ago, and he said that at that point in time, nearly 100% or 100% of the people who got the vaccine, the coronavirus vaccine, they were hospitalized or they were very sick. And that, coupled with this news of the flu shot deaths, I don't know how many people in Korea are actually going to get the coronavirus vaccine at all. I'm definitely not going to get it. Everyone I've spoken to said they're not going to get it. So what fears me is, how is the vaccine going to be the end of this if nobody's going to get the vaccine? And even more scarily, if only some people get the vaccine and many people don't, it's not going to stop the virus. And then we have the chance of the virus mutating and the vaccine could become ineffective. So all of that time and money spent on creating this vaccine, it might just be all for nothing if the virus mutates and potentially gets worse. Now, the reason why I don't want to get the virus is they say, you know, the devil you know is better than the devil you don't. I personally, even though I understand the coronavirus is extremely dangerous, I'm not downplaying that at all. I think that as, you know, a male in his 30s, I don't think that getting the virus will kill me, and hopefully it wouldn't, although it has killed people my age and it has given people my age permanent lung damage. I would honestly rather get the coronavirus than get the coronavirus vaccine, at least in its initial release. Maybe after a year after circulation, and it's been quite proven that there are no major side effects to this, but I don't know, guys. I just don't want to get a virus, or of course I don't want to get the virus, but I don't want to get a vaccine that could potentially lead to some major other health problems. I want to know what you guys think. Are you going to be getting the coronavirus vaccine when it comes out? Are you going to hold off? Do you have the same fears that I have, that if that many people hold off, the virus can mutate? And I also want to know what you guys think about these flu shot deaths. Is this a common occurrence, or is this, you know, something odd and fishy going here? Or maybe if you put your tinfoil hat on, maybe you can say that some of these vaccines were actually coronavirus vaccines being tested on the public, and these deaths were as a result of that. I'm not saying that's the case, just if for you tinfoil hat people out there, something to think about. Thanks for watching. If you liked the video, you know what to do. Hit that like button, subscribe, notification bell, the whole shebang. Thank you for watching, and I'll catch you guys soon.